top priority has always been to protect the health and well-being of all Ontarians. Our cautious approach and recent healthcare investments, combined with high vaccination rates, have kept hospital and intensive care unit stable and low at this point. However, with cases expected to increase during the winter months, and as we continue to monitor the evolving global evidence around the Omicron variant, we must remain vigilant. We are still learning about the new variant, but we can expect that the months ahead may be very challenging. The actions we take today will help ensure that our communities stay safe this winter. That is why, in consultation with the Chief Medical Officer of Health, we are taking action to further encourage vaccination and help limit the spread of COVID-19 and the Omicron variant. This will help reduce the risk of transmission during the winter months and further encourage every eligible Ontarian to get their shot so that Ontario's hospital capacity is protected. In line with Ontario's cautious approach throughout the pandemic and in light of the Omicron variant, we are adjusting Ontario's COVID-19 response to strengthen proof of vaccination requirements and enhance public health measures. This includes delaying the lifting of proof of vaccination requirements beyond January 17, 2022. This is aligned with Ontario's reopening plan, which required an absence of concerning trends before gradually lifting further public health measures. In addition, effective January 4, 2022, Ontarians will be required to use the Enhanced Vaccine Certificate with QR code and the Verify Ontario application in settings where proof of vaccination is required. We understand that not everyone has access to or is comfortable with technology. That is why people can save the electronic version of their QR code to their phone or print a paper copy. Businesses must accept both electronic and paper versions. If individuals need help printing, they can visit their local library or call the Provincial Vaccine Contact Centre to have their vaccine certificate mailed to them. They can also visit a Service Ontario centre to receive a printed copy. As we continue to learn more about the Omicron variant, we are taking these and other measures to protect our progress. Dr. Moore will provide more details in a few moments. But before I hand it over, I want to strongly urge everyone to get vaccinated and to get your booster dose as soon as you are eligible to do so. In no uncertain terms, vaccines work. On Monday, millions of Ontarians aged 50 and over will be eligible to book their appointment for a booster dose. Please do so as soon as you can. Our government won't hesitate to continue to take swift action to ensure the continued health and safety of Ontarians. But vaccines are still the single best thing you can do to protect yourselves and your loved ones against COVID-19 and its variants. So thank you. And I would now like to pass it over to Dr. Moore to provide more details about the measures that will help keep us all safe.
Good afternoon, everyone. Bon après-midi à tous. Ontario, like other jurisdictions around the world, is seeing concerning trends in public health and health care indicators. While we are currently experiencing an expected increase in Delta cases, cases related to the Omicron variant are expected to continue to rise in Ontario in the coming weeks. We must take action to protect the progress we have made and fight against COVID-19 and reduce COVID-19 transmission. This is why the province is introducing several measures that will introduce and strengthen our proof of vaccination requirements and enhance public health and workplace measures. C'est pourquoi la province introduit plusieurs mesures qui renforceront les exigences provinciales liées à la preuve de vaccination et accroîtront les mesures de santé publique et de sécurité au travail. In addition to delaying the lifting of proof of vaccination requirements, we will begin requiring proof of vaccination for youth 12 to 17 years of age participating in organized sports at recreational facilities as of December 20th, 2021. En plus de retarder la levée des exigences liées à la preuve de vaccination, nous allons commencer à exiger à compter du 20 décembre 2021 une preuve de vaccination aux jeunes de 12 à 17 ans qui participent à des sports organisés dans des installations récréatives. And beginning on January 4th, individuals will be required the use of the enhanced vaccine certificate and the Verify Ontario app in settings where proof of vaccination is required. We are further strengthening the verification process for medical or clinical trial exemptions and providing a COVID-19 vaccine certificate with QR code. To protect our most vulnerable populations, we are increasing rapid testing for high-risk congregate settings and strengthening rapid antigen testing guidance for schools to initiate threshold-based rapid antigen testing in that setting. These initiatives are in addition to Ontario's holiday testing blitz that will offer voluntary rapid antigen test screening to asymptomatic individuals free of charge. We already have a lot of tools in our toolbox that work against COVID-19 and its variants, including Omicron. We just need to follow them consistently and properly, washing our hands, wearing a properly fitting mask, keeping your physical distance, staying home when you're sick, and getting vaccinated. You have a 23 times higher risk of being admitted to the intensive care unit and a 13 times higher risk of being admitted to hospital if you are not vaccinated. These numbers should cause alarm, should raise awareness, and should cause individuals to pause and rethink why they haven't taken the benefit of these safe and effective vaccines. I'm also making a particular plea to those that are aged 70 and over and those who are immunocompromised, along with all eligible Ontarians, to get your booster dose as soon as possible to give you an extra layer of protection against COVID-19. As a reminder, beginning Monday, individuals aged 50 and over will be eligible to schedule their booster dose appointments. Et je vous rappelle qu'à partir de ce lundi, les particuliers de 50 ans et plus seront admissibles à prendre rendez-vous pour leur dose de rappel. And beginning on January 4th, Ontario will expand the booster dose eligibility for all Ontarians 18 years of age and older. Please get your booster dose as soon as you're eligible. S'il vous plaît, faites votre dose de rappel si vous êtes admissible. And just as I am asking individuals to continue practicing public health measures and get vaccinated, I'm also asking businesses and organizations to remain diligent and vigilant. We are asking that employers ask their employees to work from home whenever possible. Reducing mobility of people will help to reduce disease transmission. I know with the holidays approaching, people may be concerned what this means about getting together with family and friends. Please keep your social contacts to a minimum. Your gatherings should be small, and you should limit the number of gatherings you attend. And know the rules in your local public health jurisdiction. If you are planning on hosting holiday events, it is advisable to ensure everyone in attendance is fully vaccinated, especially if seniors or immunocompromised people are attending. And wear a mask if there are vulnerable people in attendance, even if you're fully vaccinated. We all have a responsibility to protect each other. We do not want this holiday season to become a super spreading event. Based on evidence and past experience, we know what works. By taking the actions I've outlined today, we can help to reduce the risk of transmission of COVID-19 and its variants, protect public health, and the health system capacity. This is especially important as we enter the holiday season and spend more time with family and friends. We need to keep each other safe. So thank you and merci.
How long after January 4th will having received 2 doses of a COVID vaccine no longer be considered fully vaccinated?
We are reviewing the definition of what will be fully eligible. We certainly are encouraging all those that are eligible at present for the third dose to get theirs, and we'll be following the immune protection of a third dose against Omicron to understand what immunologically represents the best protection against Omicron, and that may change the definition of what is fully immunized.
Okay, and on a different topic, because I didn't hear either of you address it today, what is the firmest guarantee or assurance that you can give parents today about what is going to happen with schools, whether there's a possibility that province-wide, not on a local level, because of course, control province-wide, whether they'll close earlier or be closed later after the holiday break, if at all? It would just be great to hear you clear that
So
up.
we'll be reviewing any risk to our school setting. I do believe it's true now, as it was weeks or months ago. Our schools remain safe. The best practices that we've put in play are keeping our children safe, and the immunization strategy that we started for the 5 to 11-year-olds will only further protect them. So at present, we're not contemplating any closures earlier than anticipated and any delays in opening. But I am concerned about the rise in Omicron across Ontario. As of yesterday, 10% of the samples detected at Public Health Ontario were positive for Omicron. And it's anticipated that we'll have a significant rise in the coming weeks and in the next month, and that it may become a dominant strain very soon. And that may change our approach. But at present, we're not contemplating any early closure or delayed opening of the school system.
Sorry, Colin, when you talk about gatherings, they should be small. How small, and why no change to the 25 people limit?
So at present, it is 100 people outdoors, 25 people indoors. Some health units have already moved, given the high risk of Delta, which is still the dominant strain in Ontario, and significantly can impact someone's health who's not vaccinated. So they, in those instances, have moved to 25 and 10, 25 outdoors and 10 indoors. So that's a risk-based approach that we're making. We're following the data across Ontario to make any further recommendations on exact numbers, if that guides people. But I think at a risk assessment at an individual level, the smaller, the better for all Ontarians.
Do you think 25 is acceptable?
25 vaccinated with a risk assessment, best protecting those that are vulnerable. So I would still, even with vaccination, it appears with Omicron that you can still transmit it with 2 doses vaccinated, that I would ensure, even in those venues going forward, that we'd have to be masked in those social settings to best protect our elderly, our frail, and anyone immune suppressed.
How does that jive with the fact that last night there was a Leafs game on? Big crowd out, there's going to be the Grey Cup this weekend. Telling people to have very small Christmas gatherings while having large venues like this at full capacity, how does that make sense? How does that jive?
Well, the good news is for those venues, the Grey Cup will be an outdoor event, so outdoor is absolutely safer than indoors. Anyone going to that event will have to have proof of vaccination, will be screened for symptoms, and masking should be maintained in those settings unless you're eating or drinking. And as well, in the large venues, we're confident in their verification process, ensuring that anyone entering those facilities is immunized. We're confident in their ventilation in those facilities, in the air exchanges, given the size of those areas. And we absolutely want people to continue to wear masks if they're not eating or drinking. And I think we have room to improve in that, having watched some of the games on TV. The difference in a social event is that you're potentially mixing in vaccinated and non-vaccinated, and that all of those other measures aren't necessarily in play. And naturally in our family environments with friends, we're closer, and the risk is going up. And that's been true throughout the last 20 months. The social venues and small groups is where we found the vast majority of risk and spread. But I'd say going to any of these large venues, it's still a risk. And you should do a risk assessment if you are elderly, if you're frail, if you've got any immunocompromise. And I'd caution about going into any crowded situation for the next month with Omicron becoming a dominant strain.
How concerned are you about case counts versus hospitalizations and ICU admissions at the moment, given the trend lines that you're seeing?
Well, I'm most reflecting on hospitalizations in ICU on a daily basis, and what gives me some relief is that our ICUs still have significant capacity to protect Ontarians if necessary, that those numbers, which is a marker of severity, remain fairly steady at the 150 range, and we remain to have a robust capacity to care for Ontarians if necessary. That's a number that I'm going to be watching very, very closely going forward, and we obviously are watching whether Omicron has a virulence associated with it. We're watching Denmark closely and South Africa closely to ensure we really have an understanding of whether it will cause severe illness to Ontarians. So.
So far?
We haven't seen any significant indication, although the uptick in ICUs in Denmark, mortality in Denmark and in South Africa is disconcerting, and we're trying to verify if it's directly related to Delta as a strain and or Omicron. So that data is coming in by the hour to support decision making, and we're working very, very closely with the Science Table and Public Health Ontario to provide us with guidance, as well as I'm sure you're aware that the Public Health Agency of Canada has released some modeling for Canada as well, anticipating that it'll become a dominant strain very rapidly.
Question for the QR code system, just for some clarity. Are you going to be mandating that businesses use the Verify Ontario app and actually scan the QR codes? Because if you're not scanning the codes, the system still doesn't work.
Yeah, that is our direction.
How will that be? Will there be fines if businesses aren't scanning? Is there going to be enforcement, and will you be perhaps supplying subsidies for companies who maybe don't have the means to have a phone to scan?
I'm not aware of the subsidy, but we do have an enforcement side that will be actively reviewing the implementation of the verification process. I'm happy to report to date that 98% of businesses have been compliant with the verification process. I've heard anecdotally of businesses not complying, but that enforcement capacity I think will increase over the holiday season and will increase the hours of the enforcement to ensure in the evenings it's being applied appropriately in high-risk venues.
I have a question for Minister Elliott.
Please.
About the medical exemptions. Minister, the Premier himself had acknowledged that the vaccine receipts could be faked. Your government back on October 15th had said you were working on a system to have public health units verify medical exemptions. I mean, here we are 2 months later, and now your government is introducing this. Can you tell us why it took you so long, and how was that responsible of your government to allow these fake medical vaccine certificates to be used for so long?
Well, part of it was with the vaccines, there was information to input into the system, and so it was easy to produce the certificate. With a medical exemption, it requires confirmation from the person's physician that that's the situation. So starting next week, people will be able to commence that process. By early January, they will be required to produce that. They will get a QR code. What will happen is that the person will go to their family physician or specialist, whoever it happens to be. They will then produce evidence that can then be taken to the public health unit. The public health unit then confirms that that's valid information, and then the public health unit inputs that information into the COVAX system. So that's for people with valid medical exemptions, as well as people who are participating in clinical trials as well. So it was a bit more different, both in terms of how to the inputting of the information and developing the process by which the medical exemptions could be confirmed as being valid.
Okay, and for Dr. Moore, I think a lot of people were a bit shocked to hear that 10% of the cases are Omicron today, which suggests that it might have been, here in Ontario for a lot longer than we may have thought, or it's spreading more rapidly. How concerning should that be to people, especially given what we saw with the Nigeria incident that happened over the weekend, where there's a lot of cases erupting out of one specific situation? How concerned should we be about 10%, and how much more do you expect it to grow?
So thank you for that. We are very confident, given the high level of whole genome sequencing of all samples provided to Public Health Ontario, where we were doing 100% of sampling up until the second week of November. So we're very confident it wasn't in Ontario at that point. We have then gone back and done a review and seen some cases at that time. What we've seen is just a sudden escalation in multiple health units where we're seeing this activity increase. And some of it has been travel related, some of it's been travel to the United States, and as a result, it's truly proving itself to be a highly transmissible strain and more transmissible than Delta, and being able to take over as a dominant strain. So I do think this is absolutely recent activity. The projections from Public Health Ontario, just received a few hours ago, are that this will continue. So we've gone from 10%, it may be up to 20% in the coming days, and then become a dominant strain, as in complete strain replacement of Delta, by the beginning of January. So we all will have to continue to adhere to all the best practices that we put in play. That's why our call to get first, second, or third doses of vaccine is so important. And we need to really reflect on how we can best protect each other over the winter holidays. I know many already had plans for social gatherings. We're asking to be prudent, to be cautious, to be moderate. I should also point out that with Omicron taking over, we have reviewed all of our protocols for our long-term care facilities, our retirement homes, and for our hospitals, all the directives that we've put in play. We're strengthening them, and you'll hear further how we're protecting our long-term care residents, our seniors, with these strategies in the coming days. It's been a very busy week preparing for the eventuality of Omicron as a dominant strain and for its infectiousness. But I want to assure Ontarians we're trying to learn from the lessons of the last 20 months. We're trying to learn from what has transpired previously in our long-term care facilities and best protect those patients.
Last question.
Can you explain why boosters, I know you've been asked about this, but in light of everything you're talking about today, why boosters can't be expanded sooner for people who are wondering why they have to wait till January 4th?
So we have to prioritize who we anticipate having the most severe outcomes from Delta and or Omicron, and it really, I think, will stay to be those that are immune suppressed, those that are elderly, those that are over 70 in particular. We're expanding it as of Monday to those that are 50 and older, which is, again, another 5 million Ontarians. We hope the majority of them will come forward to get their third doses to best protect them, and then we'll be expanding it as of January 4th. So that's a phased, staged process. We are looking at means by which we can enhance our capacity to deliver vaccine, and we are having those active discussions. But we're at 70,000 doses a day right now. We're trying to get up to 110, 120,000 doses a day, and we'll try further to bring all partners of the health system to participate in a robust third dose strategy, given how quickly this is moving in our communities.
And I understand there was quite a contentious debate regarding school closures. Can you explain your position about why you have been adamantly against extending the winter break?
I think all medical officers of health have put forth that the schools should be the first to open and the last to close, that our schools are safe. And I, from the bottom of my heart, think schools are safe, and our children have missed a significant amount of schooling in person and want to see that maintained. And with immunization of the 5 to 11s, we've done brilliantly in Ontario with 26%, I believe, as of today. We want that strategy to continue and further protect students as they return to school with their second doses in January. We will review, though, any risk or threat from Omicron and provide further recommendations, because this is new to all of us, a new rapidly spreading strain. But at present, we've got agreement that our schools will stay open and reopen on time in January.
I'll do one last question from the phone lines. Sorry, we have to go to the phone lines.
Your first question on the phone comes from Randy Ratz of CHCH-TV. Please go ahead.
Yeah, hi, Doctor. I'm wondering why, maybe Ms. Elliott would like to answer this, why haven't we considered handing out rapid tests in daycare settings so that the kids could take them home and be tested by their parents?
Well, we are extending the rapid tests. We're going to be doing a holiday blitz. We will be using over 2 million tests during the course of that. We'll be in malls, we'll be in places where people are at markets, transit hubs, and other places. So there will be adequate opportunity for people to be tested themselves and to have their young ones tested. But this is really important because that's where places where people are gathering, and we want to make sure that people can use the tests, and that's going to be another measure for us all to keep safe, because there may be some asymptomatic people and we need to know about them as well.
Okay, and I'd like to go back to the Grey Cup, Doctor. Sure, the event itself is, I guess, as safe as it can be, but there are numerous parties, large parties all over the place during Grey Cup weekend. How can you be sure that this won't become a super spreader event? I mean, people are drinking, acting as they do when they drink. Inhibitions are down. What precautions, I guess, should people be taking?
Well, all these risks, all these events have a risk. And you're right, there is a risk associated with any mass gathering. What we've done is try to reduce the risk and make it reasonable for those that want to attend. They have to be vaccinated. They should be wearing their masks. They should be screening for symptoms before they enter any social event. And those basic tenets will keep it safer, but it is a risk environment once you get that many people together. I think anyone attending should take that into consideration.
Thank you, everyone. That's it for today. Thank you. Thank you. That's all.